So there's an entity in foot health that involves an imbalance of the muscles and tendons going to the toe, and the most common type of that is known as a hammer toe. And what ends up happening with a hammer toe is the first joint in the toe begins to get lifted in the upward direction. And the most likely reason for that lifting in the upward direction is two things that are present in almost all footwear. The first thing that's present in footwear since about birth, or at least since 1 or 2 years, is we put an elevated heel onto footwear. And what I want you to notice across this joint level is when the heel gets elevated with footwear, these top of the foot tissues are going to shrink and contract and get shorter. And that's one of the things that the body does. Whatever position it gets held in, it will learn. So early on in life, we begin the process of hammer toes by elevating our heels. More commonly, the footwear feature known as toe spring, which lifts our toes, coupled with the heel elevation, is responsible for a tightening and a shortening of not only the structures here, but the long extensor tendons that go to the very last toe bone. So as we begin this process of creating the hammer toe and the tissues become tight, the first thing we see is the toe bone sitting up a little bit. The front of the leg is antagonized, or the muscles on the front of the leg, the extensor muscles, are antagonized by muscles on the back of the leg and bottom of the foot known as flexor muscles. So as soon as the extensor muscles on the top of the foot start to get short and contracted, the muscles on the bottom of the foot, flexor muscles, will try to reestablish that balance, and unfortunately what they'll do is they'll begin buckling the first knuckle in the toe. This is known as hammer toe, and essentially the hammer toe would look like this. And so the extensor tendon gets tight, and then after the extensor tendon gets tight, the flexor tendon begins to try to pull the toe down. And the downside of this is if this toe configuration is left for too long, it will stay like that. It will become what's called a rigid hammer toe, where the individual nor the physician will be able to reapproximate a straight toe position. So conventional traditional therapy is to place your faith in one of 3 biomechanical theories out there about the extensor muscles trying to substitute for tight calf muscles, or the flexor muscles trying to stabilize an inflexible arch. Those are unproven theories and are so much harder to believe than what is clearly evident and able to be seen in footwear. So unfortunately, conventional podiatric care typically tends to ignore the fact that most shoes have an elevated heel and most shoes have a toe spring, instead believing that maybe the inclusion of an orthotic device somehow can reestablish biomechanical balance. Unfortunately, too often people are given an operation for a hammer toe, which consists of incision across the top of the foot, releasing the ligaments on the other side of the joint, literally removing the joint and fusing those bones together. Oftentimes the extensor tendon gets lengthened with a surgery as opposed to the way that we lengthen it, which is with stretching. So natural, preventive, conservative care for hammer toes is to understand footwear is the cause, so we want to avoid the elevated heel. We want to avoid the toe spring, and we especially want to avoid the shoe getting narrower from the ball and pinching in. Once we have established the proper natural position, we begin the process of rehabbing the hammer toe. And we start that process by gaining greater flexibility across the top of the joint. And we do that by doing the toe extensor stretch, which is this stretch here. And this stretch takes these extensor tendons, which come from these muscles here, and it begins to establish greater flexibility. So that's step 1. Step 2, once the extensor tendons get more flexible, we ask the individual to pull up on the very end of the toe, which also will reestablish the length in the flexor tendon. And so essentially what we're doing is we're making the toe go straight. Extensor stretch, flexor stretch. And if a person can address their hammer toe before it becomes a rigid, fixed hammer toe, these natural preventive strategies can be very helpful. We also very much want to use a metatarsal pad to help pull the toe back out of that extension deformity, and oftentimes also we'll use a silicone toe separator, because the toe separator will actually begin pulling down the first component of the hammer toe, which is the proximal phalanx, which is in extension. So the correct toes will begin pulling that down. The weight-bearing force of the ground and the metatarsal pad will begin lifting up on the ends of the toe, and that's how we reapproximate a natural position.
I love running. I love running. I love running. I love running.